Hello, welcome to ERMP and beyond. Today we will discuss a case scenario related to recurrent urinary tract infections. Before starting the case, please subscribe, like and write me your feedback in the comment section. Let's jump to the case without further delay. A 26-year-old lady presented with dysuria, urgency, and frequency of 5 days duration. She has previous history of multiple treatment for recurrent urinary tract infections. What is recommended to reduce risk of recurrent infections? A. Antimicrobial strategies has no role in prevention. B. Advise on continuous use of low-dose cotrimoxazole for at least 6 months. C. Advise to use condom consistently. D. Advise to use cranberry products as it is shown to have benefit across studies. Ladies and gentlemen, welcome to today's lecture, a problem that affects many, especially women, often silently, yet significantly, recurrent urinary tract infections. Imagine facing this discomfort, not once but multiple times within months. That's the reality for some. UTIs that recur, defined as 2 or more infections in 6 months or 3 within a year, are typically acute simple cystitis. This condition is more than just a medical term, it's a repeated battle for those affected. Now, let's consider the prevalence. Recurrent simple cystitis doesn't discriminate, it's common even among the young and healthy. Picture this, in a group of college women experiencing their first cystitis episode, over a quarter were revisited by this ailment within half a year. And if Escherichia coli is the culprit, the likelihood of a second episode skyrockets. This isn't just numbers, it's a narrative of persistence and recurrence that spans from youth to maturity. But why does this happen? It's a tapestry of factors, behaviors like spermicide use, new sexual partners, and even the timing of one's first UTI can weave into this pattern. It's not just what we do, it's also about our body's blueprint, anatomical quirks, biological traits, and even our genetic script play roles in this complex interplay. As we continue our journey through the complexities of recurrent cystitis, let us delve deeper into the experiences of those affected. Imagine the distress of facing the same ailment repeatedly, where each episode brings with it a wave of discomfort marked by burning sensations, the relentless urge to urinate, and a deep-seated pain in the lower abdomen. These are not just symptoms, they are the stark realities for many women grappling with this condition. Clinical diagnosis becomes straightforward when these classic signs present themselves. Yet, there exists a conundrum when symptoms are vague or chronic, leading some to mistakenly attribute them to cystitis. It is in these instances that urine testing becomes a beacon of clarity, guiding us towards an accurate diagnosis. Now, let's address a common misconception, the use of prophylactic antibiotics. It's crucial to understand that such measures are not a one-size-fits-all solution. They are, in fact, a double-edged sword, only to be wielded when the diagnosis of cystitis is irrefutable, supported by both symptoms and laboratory evidence of pyuria and bacteriuria. Now, urine culture is not a procedure that's always necessary, but it becomes pivotal during an acute episode of cystitis, especially when there's a looming threat of antimicrobial resistance or the infection is severe. Picture this, a woman facing recurrent cystitis, her body's resilience waning with each episode. Why does this happen? Often, it's the recent use of antibiotics that emerges as a primary villain, a risk factor for antimicrobial resistance. Let's clarify the term recurrent cystitis. It's a relapse if it rears its head within 2 weeks of completing treatment, with the same infecting uropathogen strain from the original infection. It's as if the infection never left, lurking in the shadows, waiting to strike again. On the other hand, if the recurrence happens more than 2 weeks after treatment, it's considered a reinfection. This distinction is crucial, even if the infecting uropathogen is identical to the original. Now, imagine a scenario where there's no significant bacterial growth in urine culture between 2 episodes of cystitis, and the patient is not on antibiotics, or when the recurrent episode is caused by a different uropathogen strain. In these cases, we stand firm in classifying the recurrence as a reinfection. Understanding these nuances is essential for effective treatment and prevention strategies. For women who find themselves in a recurring battle with urinary tract infections, a thorough physical examination is crucial. This includes a pelvic examination to identify treatable conditions such as vulvovaginal atrophy, urethral diverticulum, fecal incontinence, and vaginal prolapse. It's these underlying conditions that can often be managed, providing relief and prevention of further infections. Turning our attention to men, those experiencing recurrent urinary tract infections should be assessed for conditions like prostatitis, urethritis, and incomplete bladder emptying. Addressing these issues is a step towards preventing the recurrence of infections. For women who endure 3 or more urinary tract infections annually, behavioral modifications are strongly recommended. These include increasing fluid intake to flush out bacteria, avoiding spermicides, and diaphragms which can irritate the urinary tract, not postponing urination, practicing proper hygiene by wiping from front to back, abstaining from douching, and ensuring to urinate promptly after sexual intercourse. These simple yet effective strategies can significantly reduce the risk of urinary tract infections. However, if these behavioral measures do not yield the desired results, we must consider antibiotic prophylaxis. The options here range from continuous to postcoital prophylaxis, tailored to the individual's needs and lifestyle. Furthermore, the incorporation of cranberry products into one's regimen has been suggested as an additional preventive measure. Cranberries contain compounds that may inhibit bacteria from adhering to the bladder wall, thus reducing the incidence of cystitis, especially after bladder interventions. While this evidence is promising, it's imperative that we seek further validation through well-designed randomized controlled trials to ascertain the full benefits of cranberry products in urinary tract infection prevention. Imagine the relief of knowing that there's a well-charted path to prevent the discomfort of recurrent UTIs. Let's explore the first line of defense, the continuous prophylaxis. This typically starts with a 6-month trial. If UTIs recur post-therapy, it's possible to resume prophylaxis for an extended period of 2 to 3 years. The choice of antibiotic is tailored based on the susceptibility patterns of prior infections, ensuring a targeted and effective approach. Commonly prescribed options include trimethoprim sulfamethoxazole, nitrofurantoin, cephalexin, and fosfomycin, each with specific dosages and frequencies to best suit patient needs. However, it's crucial to navigate this with caution. For instance, fluoroquinolones, while effective, are increasingly met with resistance and are not recommended for pregnant women and children. Similarly, nitrofurantoin should be avoided if creatinine clearance is less than 60 milliliters per minute due to potential risks to vital organs over long-term use. Methenamine stands out as a beacon of hope, particularly for older adults, proving its efficacy in UTIs prevention. For those instances where UTIs coincide with sexual activity, postcoital prophylaxis can be a game changer, often requiring just a single dose of an antibiotic to fend off infection. That's a wrap on our discussion about strategies to prevent recurrent UTIs. I trust you found the insights valuable and empowering. If you appreciated this content, please support our channel by hitting the like button, subscribing for more updates, and sharing this video to spread awareness. Until next time.